Dr. Willis for the COVID-19 update. And then as President Rodoni mentioned, we have Dan Eilerman to give a brief update on the governor's state budget.
Thank you, Matthew. Good morning, everyone. Matt Willis, Public Health Officer with the COVID-19 update. Can I have my slides, please, Alvaro? I'll start with a summary of our numbers, how we're doing in terms of the surge, and then focus on our vaccine distribution plan. This is a screenshot of the introduction page of our website. Anyone can please browse our website to see a variety of different ways in which we're describing our pandemic response and our experience in Marin. That website is coronavirus.marinhhs.org. And it shows it's updated every day at about 4 o'clock in the afternoon. So this is from yesterday. We're reaching towards 9,000 total cases as a county. And we've tested 277,000 individuals thus far, with a total of 255 who have been hospitalized in Marin County. Next, please. And this is our epidemic curve, and it shows what we've all been experiencing over the past month plus, which is the ever increasing number of cases in our community. And that's true in Marin. It's been true regionally across the state and in fact the nation. It shows also the scale of this rise in cases that we've experienced as winter has come, has eclipsed the scale of the surge that we saw in the summertime in July. And we are still seeing increasing numbers of cases. That notch on the far right there that shows a decrease in cases near the end of December is attributable to the decrease in testing that occurred over the Christmas holiday period. So there was the Christmas day and then over the weekend, and our testing operations tend to, across the county, do fewer tests, especially on holidays. So that was not, unfortunately, doesn't offer the reassurance that it might appear to. Really, it was just, and then we saw the rebound, and we're now at ever increasing numbers. Next, please. This is the current state of our hospitalizations in Marin County, and it shows that we are right now, or yesterday, had 30 individuals in the hospital with COVID-19 across our 3 hospitals in Marin. 8 of those individuals were in the ICU. We've seen an interesting and I think important trend here, which is that, and it's also been seen across the Bay Area, which is while the hospitalization rates have increased in proportion to the surge, not as many people who are coming into the hospital are requiring that critical level of care for the ICU. That lower orange line is our ICU hospitalizations, and we're at 30 total in the hospital, only 8 in the ICU. And if you look back into October, the relationship between ICU patients and total patients was tighter. And in other words, there was a greater fraction of people who were hospitalized who required critical care. That may be attributable to the fact that the people who are now coming into the hospital may be younger than, because we have seen that there's been a demographic shift again towards younger populations based on the fact that transmission is occurring in social gatherings and in family settings and in households. And it also might be attributable to, as our hospitals gain more and more experience and as there are more and more tools managing people with COVID-19, that they are able to prevent those more critical situations in which people would need to be sent to an ICU. Next, please. This shows the experience statewide. If we remember, 2 months ago, this map was more yellow and red and orange. The colors obviously correspond to the case rates. Purple is the highest case rates. It's the entire state is nearly purple. On the left there in the box, you can see Marin County's numbers. It shows that our case rate per 100,000 residents per day is 20, adjusted to 15. And then on the right, if you see the state experiences, there are 74 cases per 100,000 residents, with a 15% positivity rate at the state. Whereas for Marin, we have about a 4% positivity rate. So despite the fact that we're experiencing dramatic surges in cases here in Marin, relative to what's being experienced across the state, we have been relatively less impacted, surprisingly. Next, please. And this also now shows the blueprint for the safer economy that the governor introduced has now a new categorization, which is the stay-at-home order. It is the most restrictive policies, and it is based on, rather than case rates and percent positivity as the tier framework had, this is now based on regions, 5 different regions across the state of California. Counties that are, together in a given region are assigned a status based on ICU capacity. Any region that has collective ICU capacity of less than 15% is determined to be in the stay-at-home order. 98% of the residents in the state of California are in counties that are experiencing the stay-at-home order. We are, as a Bay Area county, our ICU capacity currently is about 4%. So we are, and our ICU capacity has been slowly declining as a region. ICU capacity in Southern California and in the San Joaquin Valley is 0% capacity. And if we average ICU capacity across the state, the statewide ICU capacity is measured to be 0% currently. So in Marin County, it's about 10%. It fluctuates day to day because we only have 3 hospitals. But the rate now is about 10% in Marin. Next, please. And this just offers the comparison of Marin County with other Bay Area counties with regards to both case rates and then hospitalizations, and shows, again, while we are experiencing dramatic increases in cases, our experience is relatively less severe than it is around us. And it says a lot about what a dire circumstance we're in as a state and as a nation when we recognize that what we're experiencing is really less than half of the average statewide. On the left, you have our case rates. We're the dark blue line at the bottom there for the Bay Area. And then on the right, it's the proportion of it's the number of our population at the population level who are hospitalized with COVID-19 at any given time. What's important about this is that you also see just that dramatic increase in people coming into the hospital across all Bay Area counties. And because our stay-at-home order status is based on ICU capacity, the trend is heading upwards, where more and more hospitalizations, more and more people coming to the ICU. So unfortunately, that stay-at-home order was extended by the state when it first expired. The first version of that stay-at-home order expired on January 8th. It had been 3 weeks. It has now been extended indefinitely based on this trend that you're seeing on the right there of ever increasing numbers of people coming into the hospitals across the Bay Area. Next, please. So this is the silver lining, I would say the light at the end of the tunnel, rather, on this is that we have a tool available to us, and we've faced challenges before as a county. This was the collective response to another infectious disease threat in the 1960s. This was in September of 1962. This was Marin County's KO Polio Day. There's a great article about this in the IJ. If you look at the archives, there's photographs, black and white photographs of this remarkable series of 3 days across the county where they were essentially able to vaccinate almost the entire county against polio in 3 days. That's a really desirable time frame for us when we're looking at a 6-month plan for distributing the COVID-19 vaccine. But it shows that, this is how we do it when it comes to a collective threat from an infectious disease. Once a vaccine arrives, this was a Salk vaccine, a huge breakthrough in vaccine technology, some drops on a sugar cube, and all these people were waiting just to take that sugar cube and get the immunity from polio. This was the way that polio was virtually eliminated in the United States in 1962. And our goal is to have that same kind of success for COVID-19. It is possible for us to actually virtually eliminate COVID-19 in our population, depending on how the vaccine actually performs. If enough of us, if 80 to 90% of us are vaccinated, we could have that same experience with COVID-19 as was historically experienced with polio. It's not something that people are concerned about in their everyday lives anymore. Let's hope we can get there with COVID-19 through vaccination. Next, please. So that's what the modern version of this looks like. There's a lot more, the COVID-19 vaccine has a lot more challenges associated with it operationally and logistically than just the sugar cube, but essentially the same process. We are working our way through our population sequentially to make sure that by the end of the day, and we're hoping by the end of June, our entire population, or everyone who is willing to be vaccinated, is covered. And we are working, with federal supplies that come down to the state and then come down to the county, and working through tier by tier. And I'll talk a little bit more about that. This was the very first day that we were doing vaccines, December 15th, 2020. This was at one of our skilled nursing facilities, one of the mobile teams that traveled to the 13 skilled nursing facilities to make sure that all the staff there were covered. We have covered nearly all of the staff in skilled nursing facilities now through this, and with the first and second dose. Next, please. So this is the current status. We are vaccinating our healthcare workers, and that is called phase 1A, and it's tier 2 and 3. And I know the terminology can get confusing, so I'm just going to I'll try and summarize that. Right now, it's hospital workers, first responders, workers that work in long-term care facilities, outpatient clinics, home health care, dentists, veterinarians, laboratory workers, and pharmacists. Those are the main groups that we're vaccinating right now. People who are outside of those groups, we need be a little bit patient. Your time hasn't come yet. We're making sure that that key frontline healthcare response is protected first. It's about 25 to 30,000 people in those groups countywide. The locations where people in those groups are being vaccinated now is the public health pod, the point of dispensing, located at the Marin Center, and I'll talk a little bit more about that. Hospitals have also been vaccinating their staff. Long-term care facilities are getting, the staff in long-term care facilities are being vaccinated either by public health or by CVS and Walgreens through a federal partnership with those pharmacies. And clinics now also, some clinics in Marin County now have the capacity to vaccinate their own staff through an allocation from the state. We do expect to move beyond this healthcare group into phase 1B in the last week of January. Next, please. So one of the things I've heard and I experienced myself is that the tier framework that has been inherited from the CDC and down through the state has so many different aspects to it. There's phase 1A, tier 1, 2, and 3. Then there's phase 1B, tier 1 and 2. Then there's phase 1C. And it's confusing for everyone, I think, to try and manage where people sit within that framework. So I'm going to try and simplify for you just the phase 1. Right now, we're in phase 1A, which is healthcare workers, which is approximately 25 to 30,000 individuals. We're going to get through that by the end of January. The next one is our older residents and non-healthcare related essential workers. That's called phase 1B. There's about 100,000 people in that group across the county, right? We have 260,000 residents. About 100,000 are in just that one phase 1B, mainly because it includes our older residents age 65 and greater, and we have an older demographically older population. And I'll talk a little bit more about that. This starts in the end of January. And then the next one after that is moving down to people, everyone above age 50, and then people who of any age that have certain chronic medical conditions and other essential workers. And that's called phase 1C. And that's about 70,000 people. And we expect to start that one in about early March. Next, please. So these are some of the challenges we're experiencing. Really, the most important challenge we're experiencing right now is the supply. We're limited, the way I'm picturing this is that they are manufacturing the Pfizer and the Moderna vaccine, the mRNA vaccines that have been approved by the FDA and that are safe and effective, 95% effective after that second dose. And we are just eagerly waiting to receive as much of that vaccine as we can to get it out into our community. We can move vaccine as quickly as we receive it. So the biggest challenge we're experiencing right now is the supply. The other challenge is gatekeeping around the tier framework. As I've alluded to, there is a relatively complex framework to make sure that those who are most vulnerable be prioritized first. Because of the limited supply, it relates to that first challenge. Because the supply is limited, as we get more doses, the CDC and California Department of Public Health essentially require that we prioritize groups according to a framework that we inherit from the state. So we don't have a lot of choice in terms of who we would vaccinate next. And we want to move as quickly as we can, and that's limited by supply. We also don't know, another challenge is we don't always know how many doses we're going to get. We find out on Tuesday or Wednesday of a given week, how many doses we're going to get the following week. So the following Monday. So we have a few days to plan. So we plan our operations. We have the vaccine, the point of dispensing up and running. And then we hope that there's going to be the vaccine that arrives to actually work through those operations. So that's one of the challenges that I think every county is experiencing right now is the uncertainty around the number of doses you're going to receive. And then another challenge for us is our county demographics. We are different than many counties in that, almost the majority of our population is in a priority group just by virtue of age and medical conditions. Next slide, please. And I'll talk a little bit more about that. So this is how Marin County relates to the state of California with regards to age. And the reason I'm focusing on age is that that is one of the primary organizers of the prioritizations. There's a group starts with 75 plus, and then we move the next priority group is 65 plus. And then in phase 1C, it's 50 plus. And if you look at this, what you see on the top there is that the median age for Marin County is 37 years. It's 47 years. The median age for the state of California is 37 years. So we are a significantly older population. And then on the right, you see columns that correspond to the proportion in different age group across the county. So what we have is from people age 50 plus, it is nearly half of our entire population is people age 50 plus, and they are prioritized in phase 1. So almost all of our population, the majority of our population is in phase 1, 46% of our population above age 50, compared to in the state, 33% of the population is above age 50. So that's going to be an ongoing challenge for us and an opportunity for us to meet the needs of our older residents in partnership with all of our healthcare providers. Next, please. Next, please. So this is the current status. We've received 21,808 doses, and we have assigned through the end of this week. We have appointments and have allocated 21,404 of those doses, and we have mechanisms for which if people are not able to come into their appointments, that we're actually able to move to others. So we're confident that we're going to be able to move through virtually all of the doses that we receive. And this is important because one of our operational goals and our strategic vision is that we do not store vaccine. We have the freezers. It's great to have the freezers, but actually what we really just want to do is as soon as we get it from the state, move it into the arms of our healthcare providers and continue to move through as we get the tiers, as the tiers move forward, continue to be able to expand our operations as we have more people in the tiers that come online to be able to continue to vaccinate people as quickly as possible. Some very good news here. I mentioned that we don't always know how many doses we're going to receive. We have been advocating to the state because we have, smooth operations built at the point of dispensing site and others with Kaiser. We're able to move vaccine, and we requested from the state additional doses because the state is really interested in making sure that as many people can get vaccinated as quickly as possible. So we were signaling that Marin County was a really good partner for the state. Any doses they get to us, we'll vaccinate people. We received this morning, and that's why it's not on the slide because I just got the word, a half hour before this meeting, that there are 6,000 additional doses that came into Marin County this week between the Pfizer and the Moderna. So we are going to have to scramble to increase our operations, which is great. That's exactly the kind of problem we want. So we were able to get the Medical Reserve Corps volunteers coming in to our point of dispensing site to expand now several hundred visits per day in that site to be able to get through that additional 6,000 doses we've been gifted just in the past 2 days. Next, please. So in summary, the COVID-19 surge continues. Vaccine distribution is scaling up. We are limited by supply. The majority of the Marin County population is in phase 1. There's phase 1, 2, and 3 in the national framework and the local framework. But by the time we get through phase 1, the majority of our residents will have been vaccinated. And the partnerships across healthcare and public health will make us successful. Next, please. Thank you. That concludes my presentation.
Thank you, Dr. Willis. Board members' questions, please. Supervisor Conley?
Thank you. Good morning, everyone, and thank you as always, Dr. Willis. I do want to focus on vaccines this morning and appreciate your update. I'll just say it, the vaccine distribution system is overly complex. It's hard to understand. I appreciate your efforts to try to break through the system of phases and tiers to make it more understandable. At the heart of it, it sounds like it's a supply issue, namely, and correct me if I'm wrong, there is an inadequate supply of vaccine flowing into our county. So I wanted to, number one, confirm that. Number two, from your perspective, how can we get more supply? What are some of the constraints? Is it a state issue, for example? If so, we need to advocate at that level for our residents. As always, the questions we're getting revolve around timing, how people will be able to assess if they're in the tier, for example, that's now receiving vaccines, how the word gets out. Nuances like, for example, it looked like essential workers, a term we're becoming familiar with, figures prominently, I think, in the next tier. How is that defined? Again, how does someone know if they qualify in that regard? So a number of questions there and thoughts, but just kind of, and you're fully aware of these issues and challenges, but wanted to kind of delve a little bit more into it, especially what can we do to make the system better at this point, given that this, by everyone's account, will be the key toward getting to that position we all want to be in, where folks are vaccinated and we can kind of start thinking about moving back to having folks live their lives. Thanks.
Yeah.
Great.
Go ahead and comment, Dr. Willis, if you want to comment on this question.
Yeah, so you're right. The supply is the limiting factor. I can tell you a little bit about how we're building the operations so that we are able to optimize the supply that we receive. For example, at the point of dispensing site that's right now active at the Marin Center, that's a facility that's been designed for the Marin County Fair and for large exhibits. So it's really an ideal setting for high throughput. And right now, it has good inflow and egress with regards to traffic flow, et cetera. We can expand operations there to probably do 2,000 doses a day if we need to. We've been doing about 800 a day in that setting now for our essential healthcare workers, and that's basically been because that corresponds to the number of doses we've received. We are fortunate in Marin to have a really robust community of first responders. So we have both professional active first responders, our emergency medical services, our fire. Fortunately right now, fire season risk is a little bit lower. There's a workforce there that's available. The governor has now allowed that workforce to actually be compensated for some of the work that they would do in the COVID-19 response. So they're excellent. We happen to have our emergency medical services system in Marin County is fire-based. So a lot of our fire people are also ambulance people. So they have the skill set. It's paramedical skill set among our fire people, which is a huge asset for us because they're able to actually serve as vaccinators. So there's a workforce there. Then we have the Marin Medical Reserve Corps, which is a volunteer corps of largely retired physicians, nurses, and other paraclinical people. That we have 85 right now who have volunteered to serve as shooters or help in any way in the vaccine more are coming, and we haven't even issued the main call to action yet, partly because when we don't have the supply yet to correspond to the need for that level of workforce. But I'm really confident that when we get more supply, we can just amplify our vaccine operations according to all that staffing that we have, working on the locations for the pods. The way we will vaccinate our community is through vaccine distribution operations, so points of dispensing, vaccine clinics. And those are, we understand how those work. They're basically, that's what's happening right now at the Marin Center. That's the same operation we did at the skilled nursing facilities. And that model can be amplified across the county. But again, the rate limiting step is just the amount of vaccine that we have. So, I mean, if there is any advocacy there to your question, it would be, we need doses. We need vaccine as a county. And that we will need more than most, because if we want to move through the prioritization framework in concert with the state, Marin County will need a greater allocation than other counties because our demographic profile is shifted towards people who have been prioritized by the CDC by virtue of age. And that's an important, I think, and another important advocacy. And that's well heard. I'm not saying that these are not messages that are not well understood already, but some support, I think, from the board would help accelerate the vaccine supply. And then I guess the other question you had was I'll just briefly touch on the complexity of the system. We are required to follow the tier framework that I tried to simplify is more completely described on our website at coronavirus.marinhhs.org. And it has all of the different tiers. There's tier 1A, tier 1, there's phase 1A, tier 1, 2, and 3. Each of them have different groups by sector, by profession that are described very specifically. And then you move into tier 1B, where you start having community members by age. So 75 plus people in certain essential workers like school teachers, food service workers. Those are, again, inherited from in that case, the state, based on the priorities of the state. And we agree with that. We think it's important to vaccinate our school staff. We prioritize getting people back into school. Food service workers, from an equity standpoint, has been one of our hardest hit. A lot of our Latinx community are working in that industry. So we're going to be working to move through those tiers. But if people want to know where they fit, that's the place to go, is to go to coronavirus.marinhhs.org. Look on the website and they can find their space. And then obviously this is published elsewhere. We're doing everything we can to get the word out. Unfortunately, a lot of the message is be patient. Right now we're just getting very limited supply into our county. So we're really focusing week by week on just that small sliver of our community that corresponds to that tier. And until we get more, it's going to be really hard for us to get beyond that.
Supervisor Conley, just to speak to the advocacy at the state level, I'm happy to work with Dr. Willis to write letters consistent with our legislative plan to let them know that we're ready to get more supply and to implement the vaccines. And so we can do that, the next day or two.
Thank you.
Yeah. Thank you, Matthew. Supervisor Moulton Peters.
Thank you, President Rodoni. Good report, as always, Matthew. I wanted to just ask if, in addition to the coronavirus at marinhhs.org, there are other ways that we'll be pushing out information. The most vocal population in my area is the 75 or older. And as you said, there's an element of patience involved. But if they're wanting to kind of know where to go and when, besides the website, are there other ways we are communicating this information out there?
Yes, I mean, we're doing, as we move through the tiers, we're working with the media, press releases, optimizing any chance, both through televised media, radio media, as well as the newspapers. We will be working with you through your distribution lists as supervisors to make sure that you are communicating to your constituents as we move into another tier. Importantly, when people become eligible based on age or medical conditions, their medical providers will be reaching out to them. Medical providers, Kaiser, for example, all of them have electronic medical records where they're able to query all of their patients according to those characteristics and send automated messages out to. So you would, if you are above age 75, you should be expecting a communication from your medical provider when we are able to move into that tier so that you can get vaccinated. In most cases, for our older residents, they will be vaccinated through their medical provider. Kaiser intends to vaccinate all of their members who are above age 75 as members of Kaiser as part of their healthcare. We will, as a county, provide vaccine as well for people above age 75 if they're not able to get it through their medical provider. So that's another, I think, important piece, is that this is part of healthcare, and your healthcare provider should be both communicating with you when you're due, but also providing the vaccine.
Thank you.
Supervisor Rice?
Thank you, President Rodoni and Dr. Willis. Thanks again also for the report. And that last point you were making in response to Supervisor Moulton Peters' questions around how will people know, when will they know, and that message should be coming from their medical provider. I don't think we can say that. We can communicate that often enough and in enough different ways. Folks need to be looking to whoever their primary care provider is, and if they don't have one, that's where the county and public health, our own public health, will come in. So I just really encourage, we'll push that message out too, but I think that's what people need to hear, and frankly, it makes sense. But folks are impatient and of course scared, and it's understandable, but we need to give them that information. My question is about, I just want to be clear, when you talk about the 21,000 plus doses received to date, when you say we, you mean our entire healthcare system, not just county public health, correct? And then also, if you could then just speak to, again, the partnership that's in place around how with our entire healthcare community with regards to, so the community understands we actually do have a strategy and we are working together, and we don't have a disparate sort of everyone out for themselves approach here in the county. I think that's important too.
Great. Yeah. Yes. To the fact that your healthcare provider will be communicating with you about this. I think one of the we are communicating frequently with our healthcare providers. I have weekly communications with the healthcare providers. I issue public health advisories. The distribution list for that is to all healthcare providers. So public health and the healthcare system has always had this sort of structural relationship around outbreaks or whatever might be occurring, where I need, as public health officer, to communicate with our wider medical community. Those rails have strengthened in COVID-19 because there's been such a need for back and forth communication in so many different elements of our response, whether it's testing, contact tracing, now vaccinations. So those are established communication pathways. We have three times a week, we meet with our hospitals in calls to see how they're doing in terms of surge and discuss our plan together. When you say who is the we in terms of the number of doses that have been received, it's Marin County Public Health and our hospitals. And there's independent, so that some of our hospitals, like Kaiser, for example, receives doses from the state directly as what's called an MCE, a multi-county entity. It's a larger healthcare system. So they're independently receiving doses, as is Sutter, which is our Novato Community Hospital, is part of an MCE, and they receive doses as well. Because we have only 3 hospitals and we have strong historical relationships of collaboration, on these regular calls, we're determining who needs the doses best next. Marin Health receives doses through public health because they're not part of an MC. They're a community hospital. They're an independent standalone hospital. So we supply them with doses. They didn't use all the first doses to get, because they didn't need as much as we thought at first because of their healthcare staff as a hospital. So they gave us doses back. So we're flexing doses across the system to make sure that we're just keeping up with the pace of the demand for our community. Right now, it's really desirable that our point of dispensing at the Marin Center is able to flex upwards, because any extra doses from any of our systems can be accommodated. We'll take any doses. So if Kaiser doesn't use their doses, they'll send them to us. If Marin Health doesn't use their doses, they'll send them to us. So there's that kind of flexibility in our system, and that allows us to be much more efficient across the county. And that's, we have a, tomorrow we're going to be getting together to really carve out the strategic plan for phase 1B. I just shared with you that about 100,000 of our residents are just in that one phase, or that one phase of 1B. And so we're really going to need to be partnering as closely as we can to get through that phase as efficiently as we can together. And that's the way we operate together.
Thank you.
Supervisor Arnold. Got to unmute, Judy.
Thank you for all you're doing. You're kind of caught in the middle, and that's never a really fun place to be, but you're doing a great job, and it's a horrendous thing to learn, and having to learn it every day, every hour. My question is our death rate in Marin County, is that still the same, or what is that now?
Our death rate?
Mm-hmm.
Yeah, it's interestingly, our death rate has not increased nearly as much as our case rate has. So the mortality rate up through July was much higher than it is now. And despite the fact that we're seeing increases, surges in cases. And I mentioned already that there's a smaller fraction of people who come into the hospital who are critically ill. And I think correspondingly, we're also seeing fewer deaths. The other reason that we're seeing fewer deaths as a rate compared to before is that the majority of those deaths were in our long-term care facilities. And the practices and procedures and support for those facilities to actually really do everything they can to prevent outbreaks from occurring have tightened up a lot. And that's, through their hard work. And now that we have staff vaccinated, it's remarkable to think about the fact that, by vaccinating all the staff in the skilled nursing facilities and residential care facilities for the elderly, we will stem the single most important driver of mortality in Marin County. Mm-hmm. Because about 85 to 90% of our deaths in the county were among residents of those facilities. And it was invariably people who were bringing the virus in from the community, often asymptomatic, unknowingly, and creating outbreaks in those settings where once it was established, it's so hard to control. And so by protecting staff, we are protecting that most vulnerable segment of our community from mortality. So that's another reason why, even just probably this week, next week, as that staff gets that second dose, where you really get up to that 95 protection, that's really where we're going to start seeing that manifest, that mortality benefit manifest.
So what's the number? It used to be 9 of deceased. Do you have?
Now I think we're 120 deaths. Okay. It's about 1%.
Okay. Thank you.
Thank you, Dr. Willis. Really good report.